Okay, I just wanted to know, I know we were just talking briefly before we get started here. You guys have had an opportunity. You bought our power brush
Yeah.
recently at the CDA, and we just would love to know like what you guys thought about that. And then you were talking about you also got um, were able to get our Swish Bar that we had at CDA, and people can see that on my Instagram that we had lined up all these mouth rinses, excuse me, for people to try. And you guys have gone ahead and implemented that into your practice. If you could tell me a little bit more about that.
Okay. We put the each of the bottles into the hygiene room, and we're asking patients if they want to try any of them. And I figured that whatever one we patients like the most, I would just buy the bigger bottle and then tell the patients this is where they can purchase it. Because I don't like to be a salesperson, but there's no way I have to promote it. If they like it, then I have to tell them where to get it. And we
Right.
don't have any literature, do we?
Mm.
We
No,
don't
we do. We do have the little.
Do we have flyers that we can give to the patient?
We don't have flyers to give out, but we have a flyer to post. But
Okay.
they're unlimited.
We,
So
sorry,
which ones do they like?
we will give you guys some of those for sure. We will
Thank
give
you.
you guys those.
Okay, which ones do they like?
Right now they're
So
going.
we'll give you guys the patient. There'll be some patient marketing, and we would love you to hand those out to patients when they try it. And you can say, oh, you can purchase it here at retail, or you're welcome to go on our GuruNanda site and get it to you. So we're really excited about that. Absolutely.
Okay, good.
Thank you.
So what have they tried?
Dry mouth.
I haven't opened all of them. I
Yeah.
opened only the blue one.
So the
The
blue one is the plaque, anti-plaque.
gingivitis, yeah.
Yeah,
And
or
then
excuse me, anti-gingivitis, absolutely. So the anti-gingivitis with the CCP or CPC, yeah. Okay, awesome.
and the green one.
The green one is our number one. It is our breath harmonizer. So yeah, that is our ADA accepted for breath freshening up to 12 hours and then 24 hours if used twice a day. So yeah, that's our most popular one currently.
Yeah, that's the one that I see mostly in over the counter.
Yeah. Oh,
And
good.
then
Is the over-the-counter price the same as our pricing?
Your pricing, as far as professional pricing, we try our hardest to always have it be the lowest price. I will tell you that our products are now found at Costco, Target, Rite Aid, Walgreens, CVS, and Walmart. Walmart's our largest retailer, and Walmart there's times when they'll clearance or they'll set the price, and Costco's the same. And so, but we, in our professional site, there's two sites, there's two parts to our GuruNanda, and I'll talk to you about that right now as we go into this. Let me jump in here. So GuruNanda was founded, really the whole philosophy of this company is natural, high quality, affordable care. And that sometimes comes with a price point that when you're talking about like high quality and natural, it sometimes doesn't have an affordability to it. But our CEO is passionate about affordability for everyone. And so he is really wanting to make sure that we get our products availability in many different places, including retail, and then we would love to have it in the dental office also for dental practices to either sell or to give out or to recommend. But that is really where he's at, is he wants affordable oral health care. You can find our products at many of the retailers that I just talked about. It's also even at the dollar store. There's a few items. And he just really wants to get oral care into the hands of everyone. And so this company is also rooted in Ayurvedic practice and bringing that Eastern culture together with the Western culture. So this is Dr. Fresh. He was actually at our booth for a little while. He's very, very hands-on in this company. He is a big social media promoter, and he and his family have their Indian roots are really rooted in this company of Ayurvedic practice. And so he has been developing toothbrushes along with his family for a long time with these companies that you see here. He did invent the Firefly toothbrush in the year 2000. If any of you know about the Firefly toothbrush, it was actually developed to help children brush longer. And so he ended up selling that patent, and then he started GuruNanda, the company, a few years later, rooted in that Ayurvedic practice. So again, this is what I was kind of talking to you guys about, is the fact that GuruNanda has several different kind of places on their website. So we have the retail site, and that retail site is for anyone, including dental professionals, if they want to buy like a single item or if they want to buy our wellness products. Now, our wellness products are essential oils. There's castor oil, there's there's MCT oil that I'm going to talk about today. There's mouth tape, there's nasal irrigators. There's also a parasite and gut cleanse. There's some amazing things. We are continually moving forward in that wellness space too. And then we have our oral care line we started later after GuruNanda. The company started because what we really had was an issue with the retail site doing so well, and people then going to their dentist and their dental professional and asking about the product and them saying they didn't agree with it. So GuruNanda actually in 2023 started going into dental shows and promoting, like we did at CDA. And CDA was our first one in 2023 that we jumped into that space to educate dental professionals. And we have had such a warm welcoming in the dental space since we've started this. And so, you know, I wanted to introduce myself again. If you guys, I think I talked to you guys at CDA, but I am a national speaker on oral systemic health. I have been with this company for 3 years. And I love this company. It aligns with everything I want. It is really about oral systemic and about individualizing patient care, which is getting people outside the box that we tend to put people in where they may not even feel comfortable. And so today we're going to talk about products that kind of blow that box apart. And I know you guys have already gotten to see some of that as you've been introducing this. Again, I will say periodically along as I go, like you can find this at Walmart or your patients can get it on our website. Again, retail and the professional site are different. The professional site is more case loads. So we try to give the professional the best price, but you'll need to buy it in a larger quantity. So you'll hear me also reference, like if you want to buy these, we have a really good price and this is going to be the price point. I don't have a lot of the prices available. I will tell you what was available at CDA. I know you guys did purchase. It ended on the 31st of May, but I know Lene, because you're having this today, there's a chance that if you messaged her, because I'm going to link you again afterwards, that you can definitely reach out to her and say, hey, we really want this. Is there any way we can get it? So anytime we have a show, the next show coming up is Under One Roof. It will be in July. And when that show comes up, if you reach out to her, she'll let you know what the specials are. And she's very, very accommodating for that. So, and we'll send out things periodically like, oh, we have free shipping or we have this going for the dental professional. So you guys can get that website. This company is completely rooted in Ayurvedic practice. That's been around for centuries. It's really, really based on that oral systemic, especially that whatever's happening or whatever we're bringing into our body is going to really matter to the body. And so the Ayurvedic practice for people who are really in that culture and practice is that first thing in the morning on an empty stomach, they rinse with oils, and usually they're using a cooking oil. That oil could be, most likely it's either coconut oil, sesame, or sunflower is what they traditionally use. And these oils then are put in the mouth and they're swished around as those oils bind and hold pathogens. And then they spit them out. Now it's 20 to 30 minutes with their oils. It's only 2 to 5 with our oils because we're the #1 oil pulling company with the ability to have fractionated oil, that it allows that oil to swish with 2 to 5 minutes and start to bind those pathogens. We also have other essential oils in ours that we'll see in a second that actually make it beneficial to our patients. The mechanism of action how this oil works, there you go, is similar to what we think of oil for any engine. So engines, our oil in our car does 2 things. It lubricates and it cleans. if it didn't clean, we would never have to change the oil. We would put it in one time and then we'd never have to change it. But if you've seen oil changed in a car, the oil has a lot of particles and dust and it's dirty. And it does that as it protects the engine as it grabs those before it can get into the engine parts. So similar to the Ayurvedic practice of oil pulling is by swishing around in the oils in their mouth, they're grabbing and holding toxins and pathogens. We know that the nighttime is the most pathogenic. As we have a reduced saliva flow, we have more pathogens. We're also, a lot of people are mouth breathing now, and we're pulling in those toxins that are in the air and also in our waters and things like that. So we have this ability to grab and hold those toxins. And then we ask them to spit it out and to brush, floss, and tongue scrape. It is not something that we don't recommend. All of the other dental techniques and things that will help to eliminate pathogens or to reduce them and to create a better oral environment. So we're excited about that. And really the combining of that oil with the saliva creates a beautiful kind of emulsification. As you know, when you make even salad dressings, you can shake the particles up, go float to the bottom. And if you shake them up, they start to bind and hold. And then if you emulsify it with a blender, it thickens it almost into a cream. And that's very similar to what's happening in the mouth. And again, 2 to 5 minutes is adequate. We do have research showing that, and I'll show you in just a second. The other things that, yeah.
I'm sorry.
I
So
want to ask a question as well.
the
Absolutely.
So the oil pulling, those are the drops, right? How many drops do they usually put in the mouth?
Okay, so the oil pulling is actually, it's not just drops. It's actually, they can put up to, I think it says recommended 10 to 15 milliliters, like what I tell people is if you put too much, 2 to 5 minutes, you're going to have too much of a mouthful because your saliva is going to start forming, which we want. We want that natural HA, the hydroxyapatite, to also start to form. We want the natural saliva to just pick up and start going. The problem is if you put too much in your mouth, and there really isn't a recommended amount because everyone's mouth capacity is different. Yep. So please just tell your patients when they're using our oils that they need to put enough that they can swish, but not too much to where they feel like they have to spit out before the 2 to 5 minutes. So just enough, and they have ability to do things with their hands. They can make lunch. Some people will shower while they have it in their mouth. We do ask that you spit it in the trash just because oil is binding and holding, or it can actually lose some stuff. So we don't want it to have any kind of complications in your pipes. So we ask it to be spit into the trash. So
how long does it supposed to be in the mouth?
2 to 5 minutes.
5 minutes, that's a lot.
2 to 5 is our recommended time with our oils because they're fractionated, meaning they're already in a liquid state. If someone's pulling with regular cooking oil, it actually takes 20 to 30 minutes for that oil to get into the state where it actually can bind.
To start pulling.
Mm-hmm.
Yeah, before it starts to pull and hold.
Ready to pull. So
absolutely. Ours is ready to go in 2 to 5 minutes. Mm-hmm.
So its base is mainly coconut oil then, right?
Yeah, our number one base, that's called a carrier oil, and the carrier oil is coconut oil. So, well, I should say most of ours is coconut oil. We do have a sesame I'm going to show you in a second. And I don't think we have a sunflower. I think we just have a sesame. But that's traditional Ayurvedic. The coconut is beautiful. It's anti-inflammatory. We love it. But we also have other essential oils in ours. As you can see here, these essential oils are oils that have been used in dentistry for decades. They used to help either breath freshening or with reduction of or increase in the saliva, reduction of pathogens. We have tea tree in this our number one oil pulling has tea tree that can help with yeast or candida. There's so many good things, and we have some other that I'm going to show you in a second with our cinnamon. In fact, Dr. Fresh just posted about the cinnamon, ashwagandha, and neem oil, which is getting huge publicity right now in dentistry because we're having some of our salivary testers using it and finding that it can control certain bacteria. And so it's going to be exciting as we move into salivary testing that we can start to really customize care. And for those who really want something that's not a harsher antibiotic, but that can help with something some of our oils may be extremely beneficial because of the essential oils that they have in them. So,
I'm sorry
um,
for repeating myself. You said this is done before you brush, floss, and all of the
yeah.
above.
So this is the actual Ayurvedic practice. Of course, anybody can do whatever they want, but the Ayurvedic practice is first thing in the morning on an empty stomach is to do it. Like before they eat, drink, talk, they don't want to swallow any of the pathogens and toxins that have been formulating all night and put them into their gut. That is the big thing, is barrier, creating that barrier. And so that's why they oil pull. That's traditional Ayurvedic, like let's keep everything from entering our stomach that isn't going to be beneficial. And so, but some people like to do it twice a day. It just depends on the patient. There's a lot of essential oils in our products, and sometimes people don't respond. They respond well for a while, but we also don't want to get those bacteria into a state where they're going to be immune to it or have a certain bacteria grow too much. Or, we got to have that balance so everybody's individual, 100% individual for sure. And by the way,
How about patients with a dry mouth?
Oh yeah. Ooh, I love it. We're going to talk about that. That's coming up because the other thing that oil in your car does is it lubricates. And that's the second part. I do want to tell you, this is just a slide that shows you that we do have research right now on our website. You're welcome to go and to see. We don't spend a ton of money on research because we want to keep our products lower in cost. This is basically based on Ayurvedic practice that's been around for centuries. Again, it's going to be something that works for some and not work for others, but in general, we're finding many patients are benefiting from this and they're happy to use it. We also have our study showing 2 to 5 minutes. There's also a study showing about the benefits of anti-inflammatory effects of coconut oil, which is mainly our base, and also some things about strep mutans and gram-negative and positive bacteria. You're welcome to go on there. We don't have a lot of time to go into those, so I welcome you to go on and look at those. We do have our oils in different sizes and also different flavors. We have a children's pulling oil, by the way. That oil is a berry. So anybody that doesn't like mint, almost all of our stuff is either mint or cinnamon. If they do not like it, please have them go and get the children's one. If they really want to pull and do that, they can use the children's one, which is berry. We also have, this is the ashwagandha neem and a Ceylon cinnamon. This is a beautiful product that is gaining a lot of recognition right now in anti-inflammatory. The neem is amazing for anti-parasitic and also really helping with controlling some bacteria. So I don't know the bacteria strand, and you won't know until your patient does salivary testing. So, but we do have our good friend Heather Keeney working with Bristol Health, and she is an oral health coach, and she's been using this on quite a few patients and finding great success. So there's just things that you can think about.
For these three, so this one is a cinnamon.
This is our original, and it's just those little sachets like you can get, so you can just give out one little sample, and that came in your oral care kit. We'll be giving you those again. I'll send those to you. Again, remember to keep a list right now of things that you guys are like, yeah, we want to try that. We want to try that. We want to try that.
I want to be able to, the reason why people don't believe in oil pulling, because when it first came out, it said it proposed to do too much. It proposed to reverse decay, and then it couldn't do that. So then when people found out that it didn't work, then that's when they boo-hooed oil pulling. Right. That was when it started, because it was supposed to be this
and part of that problem was the fact that in our country, it's a great benefit to have the freedom of speech. And we were having a lot of retail people that were jumping on, and they were actually promoting it for things that we weren't necessarily.
Yes.
I will tell you, we do have studies showing that it can help with strep mutans. We do have studies talking about, I know personally that I've been using the oils for people with a dry mouth. So to say that it can't help prevent possible white spot lesions or erosion or some, we have a lot of pH neutralizing products. So the point is there is benefit in our oils that could help someone. but it isn't going to reverse
Yes.
necessarily.
But that was the bad mojo. That's when
Yeah.
that was my bad mojo because the guy goes, "Oh, my cavity went away." I go, "It's still there."
Yeah, and it wasn't a
I know you're oil
dentist.
pulling,
I
but it's
know.
still there,
Yeah, absolutely. Yeah. And that's where we really wanted to educate the dental professional. And you'll notice in here, I don't ever say like you're going to reverse cavity, your patients won't have to have root canals anymore, like things like that. This is made to help remove toxins and pathogens. It's going to help also neutralize the mouth with their pH ability and with the lubrication. So oils are beautiful and they do lighten, kind of give a brightness to the teeth too, and help give that barrier. So,
Kristin, by any chance, do you think we can get this PowerPoint email to us?
I'm recording this so I can send it to you.
That's
Oh,
perfect.
thank
Yeah,
you.
yeah, that
Okay,
will be
so
my gift to you for letting me send it to GuruNanda for education.
oh my
Thank
God,
you.
there's more. There's more
So these are,
flavors.
hey, you guys, these are my favorite oils. This is my favorite part because I'm a big advocate. I speak on bone health and hormones and women's health. So this is my favorite part of the presentation. Now, this is off-label use. I'm going to just tell you, these are pulling oils that people can use. This is a pulling oil that's MCT only. Beautiful, fractionated, nothing added to it. It's coconut fractionated MCT oil. This is an amazing product that I use for my dry mouth patients. Anybody with chemotherapy, anybody struggling with any moisture. I can't say xerostomia, dry mouth, because it's a medical condition. So I will just tell you, anyone struggling with moisture control, this is a possibility to do this oil. We also have the MCT oil and peppermint. Now, I'm not a big fan of swallowing a lot of essential oils, but what I'm saying by the I have two ways that I have these people, my patients use this. This one does have the peppermint for breath freshening. This one is sesame with peppermint so that if they want to use a sesame oil.
This is Asian.
So I will tell
The
you,
sesame was Asian.
yeah. So this is amazing because also our oils are under $20 for them to purchase. And right now in dentistry, we have one other oil-based dry mouth product that is around $100 and you have to buy it at a pharmacy. These oils are accessible. They can be used off-label for the moisturizing. So if you're cleaning, it's 2 to 5 minutes, spit it in the trash, brush, floss, tongue scrape. If you're lubricating, I tell my patients to use specifically these because the other one has tea tree and we know we don't want to swallow tea tree, and tea tree and some of the other essential oils are pretty strong to use regularly throughout the whole entire day. But this one they can use.
I wanted to ask you something. I'm going to step back out for a second. I'm getting ready to leave. I just wanted to know, you have them use this, right? The oil, but we also have the mouth rinse. How does the mouth rinse work? I need to know how the mouth rinse works with
Do you want me to jump to the mouth rinse real quick?
Yeah. So you see,
Yeah.
Before you leave,
they're going to ask you that. Should I do the oil or should I do the mouth rinse? You know they're going to ask you.
Yeah.
Or do I do both? But I need to know how to use both.
Okay, yeah. So we also have our signature concentrated mouthwash. This is actually oils in a beautiful bottle, a small bottle. This is 300 uses. It's all of our essential oil blend and they can add it to water. This is for our crunchy people that really don't want any plastics. They can utilize this. It's a beautiful blend of, again, all of our essential oils for antibacterial, antifungal. Remember, this is the one that has all the essential oils. Different from the one I use for dry mouth, which is again, putting a little in your mouth, rubbing it around, and you can swallow or spit it in the trash. Again, that's when you're using that 2-ingredient or 1-ingredient MCT oil. Okay, that's my go-to for my low moisture. But if they want to use the mouth rinses, these are all water-based. We know water-based products are always, they're not going to hold on as long. Our dry mouth, I don't have a picture of our dry mouth, but you guys have it. That one has a little glycerin in it. So we know that creates a little bit of a slippery ability. It gets that moisture and it also gives you some lubrication.
Slimy.
And I notice it's thicker. Yeah.
It's thicker.
Yeah, it's
That's
thicker.
The first one we use.
Absolutely. Yeah. So these are more water-based. They're not going to have as many essential oils, even though they do have some. So this is going to be for a person who maybe doesn't like the oils. I had someone that just reached out and told me that they're very sensitive and they didn't like having oil in their mouth. Then the dry mouth one's fine. People can mix both of them, like not mix together, but let's say you have a severe Sjogren's patient that is trying everything. they could do a little bit of the oil, then they could switch to the dry mouth one because it does have a sweetener to it. Where are my other oils right here that I was talking about, going back, these oils do not have a sweetener in them. They are just oils. So
And
the
how many
main
times
thing,
a day can you use the oil?
if you're using it for lubrication or these oils right here, you can pull or you can lubricate as many times as you want because there's not a lot of essential oils. This is just
Yeah.
coconut oil.
Yeah,
In
because
fact,
essential oils are,
the-
you can't take too many of those. I can't do tea.
exactly,
I
100%.
can't do tea
We-
tree at all. I can't do
We
tea tree.
totally, I totally am in agreement that you have to be very careful. It's individual. Essential oils can be super strong. And so,
because we have a lot of seniors and, they don't remember, a lot. It has
Yeah.
to be like simple and
simple,
those
simple.
are who we're
So if you
targeting.
want to be completely simple, I would use these oils. I would probably do the MCT is the best one. It is just coconut oil. Even if someone swallowed it, it's just coconut oil. It's not, people put this MCT oil in their coffee all the time as a just, normal thing that people will do for health benefits. So I would have, if you have a senior, I would have them using this one. And again, a little bit in their mouth, rub it around, and they can swallow or spit. That's if they're lubricating. If they actually want to pull the pathogens first thing in the morning, then they can do
Then
that.
I can do the 3 to 5 minute thing.
Yeah, 2 to 5 minutes. And they can use.
I personally hate coconut. I drink coconut water
doesn't
every day,
taste
and
like
I
coconut.
absolutely abhor it. And I've been trying to get used to it. I still hate it. So I want to try
Okay.
the other two.
Yeah. Well, I can send you a sesame for sure. And I'll send you the sesame and peppermint. Make sure you put that on your list that we
Yes.
need to do that. But I'm going
Yeah,
to tell you
because
the coconut, the MCT coconut does not have a coconut strong flavor. It is
we'll do
not coconut, artificially
Try it.
coconutted
Yeah.
flavor. Yeah.
Because I can't
It
stand
really
much-
just is like oil.
How much does a bottle, 8 ounce bottle cost for patients?
So it's under $20. It kind of depends
Okay.
on where they're going to buy it, whether they're buying it on Amazon, our website from you. Your price point, I think at the CDA, they were running $7.99 or $8, something like that, around $10. If you bought some of those for your patients. So,
Okay.
but
No,
for
it was very,
them,
very dentist office friendly.
Mm-hmm.
Because that's how they
we
get it out there.
so try. We so try. We really want you guys to have our products. That's why we did that. The whole Swish Bar is we want every dental office in the United States to have a bar that they can have patients come and actually utilize which one they want to try or try a couple. How many times is that available at a dental office for people to sample like different
really.
types and say, what do I like, without them going to the grocery store and buying one and then going, I hated that. And then going back and then, oh, that burnt, or I didn't like that flavor. And then they don't buy it again.
Yeah.
So yeah. So I love it. Our mouth rinses also. So we have, you got them all. I would say it's just preference. The oils are mainly for cleaning and lubrication. The mouth rinses are more for breath freshening, pH neutralizing, and the ability to, there is hydration in them also. They just are kind of different. They're just another option, right? We're all about options. So yeah, I'm going to move on to just the only other one I wanted, and she may be gone already. Well, we're recording this, so she can listen later. Our water flossers are amazing. These can be put in the shower. That's one of the big things I love about it, because you can charge them and they're waterproof. They also have 3 settings. They're very friendly to use, like very easy to use. They do come with 24 of our aqua pods, and that's our concentrated mouthwash. I'm not a super big fan of putting things in a water flosser, but some patients may want to. But I'm just not a fan of putting things in a water line that isn't water. However, they're using tap water mostly, and we know all about that in dentistry, that who knows what. But these do come in the aquapods. They can use those aquapods separately by just putting them in with water. So they can use them in their water flosser, they don't have to. But I love this. This price point was $16 with free shipping at the CDA. And so again, our price points are really, really good.
And how much is it on Amazon or?
So Amazon, we never know, because again, those can be
Whoever.
secondhand sell. Yeah.
But they call what, $20 too?
So they're like, I think they're $29.99 or $39.99 either at Walmart or on our website. Walmart and our website are pretty close as far as cost. Walmart again can clearance, they can put a sale, whatever they want to do.
And what's the difference between this water flosser and the oh my God, what's the other
Like
one?
a water
Water
pick.
pick.
Water pick,
Yeah.
yes.
They're very, very similar. We do not have a pickpocket tip. We just
So the
don't have
pressure's
that
the
right now.
same.
Yeah, the percentage like is for the water flosser it says right on the flosser that it comes with, I think it says, I'm trying to read it without my special glasses. I think it's 1800. Yeah, I don't see it on there, but anyway, it has the pressure of it is comparable to them. So, but our price point is really, really a good price point. So
It is rechargeable, right?
it is
Yeah,
rechargeable,
rechargeable.
absolutely. Yep.
Fruitless.
Yep, and it's
Mhm.
waterproof, and it comes with the little C recharger that you see there. It comes with that. So, yep. And our power toothbrushes, like you just received, what I love about that power toothbrush, which I would love you guys to at the end to let me know what you thought. But one thing I love about it is that it does not have a charging bank. Like you don't have to actually put it on anything, because sometimes people lose those and then they're donezo. Like there's no charging the toothbrush anymore. The other thing I love about our toothbrushes is that our new head has very soft bristles. We've tried to make it as soft as possible, which you can't go super soft on an electric toothbrush for the ultrasonic action to work. But we do have a softer toothbrush, and our heads, I think at the time of CDA, when we were looking at it online, I think the heads were 6 heads for around $10. Like
Okay.
that's an amazing price for 6 replacement heads for around $10.
Yeah,
So
that's awesome.
again, like that's the problem is you get into these toothbrushes and they're expensive to begin with, and then they can't replace the heads. And we
Right.
know that
I
it's
know.
not
So
good.
what's your question? My
Yeah.
questions are the bristles
Doctor has
polished?
questions.
Yeah.
The tips are polished?
Are the
The tip-
bristles polished on the toothbrush? On the electric
the-
toothbrush?
No, on the we actually returned a bunch of our gum brushes, right? Because we ordered we just returned 1,000 toothbrushes.
From
So
Of
we're gonna
ours?
buy yours.
Oh, yeah. Oh,
But I
I thought
wanted
you
to
maybe
ask you-
returned ours. I was like, what happened?
Yeah, no. I wanted to let you know that we're interested, but when I talk to patients, I actually tell them why I chose it, but I don't want to just say I chose it because it's nice and soft and it's pretty. I don't want to say that. I want
Okay.
to I want to be able to tell them
Is it
like
polished?
you have 8,000 bristles, which is more than anybody.
We have
That's
8,000. We have absolutely 8. This is the toothbrush. We have 8,000 bristles. It's an ADA accepted toothbrush. We have the bristles also are on different planes and different positioning to allow for a better clean, but
Yeah, I
to
can see
allow
that.
for the soft nature of it. So it has the soft text bristles. That's just kind of it's a trademark that we have. And so it allows, I will tell you, this toothbrush stands up. Like it does not, it's not a toothbrush that you're going to be like, oh, like after a month it was destroyed. I'm amazed at how much this toothbrush stays intact by using it. And it's so soft. I just posted on LinkedIn. It's still trying to download possibly. I'm posting because I was involved in the Special Olympics Idaho, and this was the toothbrush that they gave out to the athletes.
We're sold on the toothbrushes, right? We're going to order. I usually keep a whole year's worth in stock, so I need 2,500 in stock.
Yeah.
So we can't return the other ones. We just bought another 1,000, right?
Yeah.
So we're returning 1,000 of them so that we could replace it with yours. But
Perfect.
I didn't get a tongue scraper. Did we try the tongue scraper?
We're going, yeah. So the tongue scraper is stainless steel, medical grade. This comes in that oral care kit that is available also for you to, we are changing, I'm kind of going all out of order here. This is
No, it's okay,
our,
'cause
yeah,
We've
this is
been
our oral
studying
care
all your
kit.
stuff before this meeting, so it's not
Yeah.
like we're just
Yeah,
looking at. We've
yeah.
been like everybody took their stuff home
Perfect.
the day after
I
to
love
make
it.
sure we were really happy with it, but I don't remember getting one of those.
think it was.
So I'm going to send the oral care kit. We also gave it out at CDA if you
You did
were
get
one
it.
of
It
the
was in
people
your
that was
kit.
there. So it does come with the stainless steel tongue scraper, the little flossers, the toothbrush. We are redoing this. We will have a new oral care kit available that will have a toothbrush, a 1 ounce toothpaste, an expandable floss, and our oil. We're really excited about that. That's coming
Oh, so
out
the
soon.
oil. That's
Yeah.
good. The oil
So
is
there's
good.
there's the
Okay.
sample of the oil right there, and that comes in this kit currently. It was
We have it.
99 cents at
Mhm.
the CDA
Okay.
event.
My question is, how much are the tongue
The tongue
scrapers?
scrapers.
They're
I
around
have
a
them
dollar.
in
I think they're around $1 a piece, which this whole kit was $1. So I was telling people, if you're
So
going
I
for the
could just
tongue
buy this
scraper,
kit?
it was
we buy the
$1 at the
kit?
CDA. So yeah, if you contact Lene, she may still give you the CDA special.
Yeah,
Yeah.
so I could just buy the whole kit for the patient?
Yes,
whole
you can
kit
buy
is
the
not
whole, that's
$1.
what,
How
and
much is the whole kit?
so the
She
whole
said
kit,
that-
right? Well, it was at CDA 99 cents or $1. I don't know what it currently is, but Lene, because we're only a few days past the cutoff,
She might
because
give
you
me
guys were
for that.
CDA, because you had this today, because she may be able to extend it to you. This,
have
I
food and
love
ice
this
cream
though,
for
because
pizza.
they're all individual.
And look at all
So
that.
so you can take them apart and give a toothbrush, a tongue scraper, the flossers, the oil. So I tell people it's a no-brainer for $1
Yeah.
because it has everything. Our
Especially for a
new one
man.
that will be coming out will be a little bit more because the toothpaste, I'll show you, our little toothpaste is amazing. And it is, so this is our
Oh,
1 ounce
yeah, yeah.
toothpaste,
Kristin?
and
Yeah.
it is in
Kristin?
a beautiful branded. It's
Yeah.
just beautifully done, and it will cost a little more to have that toothpaste put in.
Kristin,
But yeah.
you're messing with us. You're giving us way too much stuff that we
Oh,
want to buy.
I have so much for you because I'm telling you, this toothpaste right here, this sensitive that we have that's brand new, it has white turmeric. It has L-arginine, it has xylitol, it has nano and hydroxyapatite, and it has potassium nitrate. This is a toothbrush every single person should use. It's my favorite. It comes in a 1 ounce soon, and it has the 4.2 ounce that people can buy at Walmart for around $8.
Because
It's
that
available.
has everything we want in it
It is
without
the
chemicals.
most beautiful toothpaste I've ever
That's what I put
used.
on here.
And then we do have a new toothpaste booster that
Do you guys have 1 ounce kit toothpaste?
we just got 1 ounce in this one, and it's the strawberry
The big
mango.
one, but she said they're gonna
And by the way, I just had
I'll do that.
somebody from
Because
California.
we looked it up online.
Get
We
it?
already like
couldn't find it.
scrolled your website.
We already stalked you.
We stalked you after we got
Perfect.
back and looked at every single thing. And
Perfect.
I just bought kids toothpaste
Mhm.
because you didn't have the small size for the kids.
Right. We do have it now. Or it's being, I have a couple of them in my bathroom because I got them at CDA. We did hand them out at CDA. We only had a few.
Yeah.
So they are probably up and running now, or they will be. And we're going to have kits for pediatrics.
It's
So
You don't
And-
have them yet, though.
not yet.
I don't know. Are they on our website yet?
So the kits for the
Lene
pediatric,
may
are they
be-
gonna have
Lene
different
may
size
be able to get them
toothbrushes?
for you. That's something that it's kind of between the website and our, Lene is
Website.
amazing. So
think-
she would tell you when they're available.
Will the kits only be for 6 and up?
So the interesting part about that is our toothpaste prior to this one was one I loved because it was actually for infants. It had less xylitol. The reason why they kicked this up to 6 years old is because of the 25% xylitol they put in it and the
Mhm.
micro hydroxyapatite.
Okay.
So because of that, they just say 6 and up because they want them to be able to spit. But in all honesty, like I would say you don't have to have enough. There's probably not enough toothpaste to make someone have a stomach ache from xylitol.
Mhm.
However, if a child were to eat too much of it, it's not going to be toxic like fluoride,
Yeah.
but it could cause some stomach upset. But this one is to help really with cavity prevention and stimulating saliva. So we wanted to have it comparable, like an alternative to fluoride. And so this one is 6 and up, but I would tell you personally, I would have my grandbabies use this over any fluoride toothpaste for sure. So you just have to be careful with the amount because it's really about the xylitol.
Okay.
And there is, I think, I don't think there's any tea tree at all in our strawberry mango. But we do have tea tree in some of our other oil, our oils and our mouth rinses. And so that's why tea tree isn't great to swallow either. But in all honesty, we have no fluoride in anything but one rinse, which is the anti-cavity rinse that's available. So anything is pretty safe. We did, by the way, someone scanned this one and our toothpaste, and they came on their clean app. They came out as extremely clean. And so they told me that. And I was like, oh, we're super excited about that. So yeah. So we will have 1 ounce in the sensitive. We already have the 1 ounce in the regular, and we do have, because I've seen it, I have it. We have a 1 ounce in the kids, and we'll see if that's available. Sure. I'll
And
send
how
those.
much will we get a pricing list for?
The pricing list is when you go on the professional site, or you can always message Lene and ask her what the current price is if you're wanting to put in a big order.
What
She
is her
will
email?
help you.
Could you do you know her email?
I'm going to send it to you afterwards.
After?
Yeah, and on
Okay.
the very
Sounds
end
good.
slide, that very end slide has all the contact information for both her and I.
Okay.
So there's the kiddo brushes, by the way. These kiddo brushes are amazing. And they don't have any latex, BPA free. This is our little giraffe. He's a little bit more money, and just because he takes a little bit more to manufacture, but a lot of dentists like to use this because this can be used as a bite block. So if you do need to use that, the kids can kind of put it in as a bite block. And this one was renamed at CDA as my hot dog toothbrush by a little kid who said it's mustard and ketchup. And so that's my new hot dog toothbrush.
Is there an age difference between those two brushes?
They are the exact same head.
Okay.
So the head is the same on those. We do have on our retail site, which is a little interesting, we have a lot of different toothbrushes. We have a gentle giant that's a bigger one that has a stiffer brush. And then we do have a medium size head of our butter on gum. And that one sometimes comes even with, if somebody buys an oil, they'll open the oils, and Dr. Fresh is always putting in things like, hey, let them sample this or that. And sometimes you'll get that toothbrush. And sometimes those are at the dollar store and things like that. But for the professional, we just went with the butter on gum the standard head, and we went with this one as the kids. So we just have those two. Doesn't mean we're not going to get more. Like, we just introduced the ready to go brushes. These are pre-pasted with xylitol toothpaste. They are an amazing price point.
They're so cute.
They're so good. And they're made of 100% recycled plastic. We are trying our best to still have a super soft toothbrush, but have it withstand. By the way,
same bristles, same different size head.
It doesn't have there's not 8,000 because it's awful small. But yes, we still have the soft tech. It does have the bristles that are super soft in it. Way softer. See, it says ultra soft tech. That's the trademark of the bristle. So yes, we do have, and they are all it's just like a miniature of our butter on gum brush. So
that's what
and these price points are really good, and your patients can also, we always give the dental professional the best price, but they can also purchase them at Walmart on their own and buy some. And Target, Dr. Fresh just did a social media post. There's 5 of a pack at Target. He's like, these are always sold out. People must be traveling a lot. So, but that's our butter and gum. We have our expandable floss. You guys probably got to try that. The biggest thing with this floss,
you
didn't get to? Okay, so
you had just one there that was used.
So right now we're using cocoa floss because we love the expanding floss, but it's pretty not cheap.
What? You're gonna love ours then, because guess what? We have 10 yards. This is expandable only where it contacts, so that you can actually slip it through, or I can slip it underneath sometimes retainers and then use it. Where super floss, sometimes you're already expanded, it's really hard. But this will expand. It comes in non-flavored mint, vanilla, and cinnamon. It also comes in 55 yards on our retail site, or if you ask Lene, she can get you those for your office if you want to have those for the hygiene.
The
Mhm.
cost for a small cocoa floss that's only like 10 yards is $9.
Okay. Do you know
That's
how much our
crazy.
10? Do you know how much our 55 yard is?
How much?
It's around $1.
Oh, yeah.
And these right here at CDA were 37 cents
Oh, wow.
with free shipping. So if you guys are interested, we do not have any forever chemicals and ours is non-allergen.
How much is the
Okay.
10-yard?
The 10
55
yards are
yards.
37
37
cents
Oh,
each.
sorry.
So we need to like order some of the floss for the
Yeah.
patients after we try it.
Absolutely.
But then after we try it, then we don't get the same pricing.
So we
Well,
have to
we
ask her
run,
because she said we have to email her.
Yeah,
yeah,
but we
and
don't
and
know. How do we know if we like it? Saida has to test it.
Mm-hmm.
Unless I go to
the-
Walmart and get some for her to try. I mean, that's the
You
only
can't-
other way. Or you guys
Yeah.
go and I'll give you money. I'll give you 33 cents.
Okay.
It ain't gonna be 33 cents at
So
Walmart.
Walmart's 55 yards because these 10 yards are only available to dental professionals. No
Okay.
one retail can buy these. So these are
Okay.
for you. Now, what some offices do is they take the 10 yards for their hygienist, they just take a section out and they floss their patient, then give the rest. But some will order the 55 yards for it's $1 or something. And then they utilize that in their hygiene room. It only comes in mint and cinnamon.
You know,
Um,
you have no idea. I bought 400 something dollars worth of cocoa floss
Cocoa
in
floss?
all the different flavors. It was 400 something
Oh,
dollars.
yeah.
Yeah, so now I feel bad and I'm leaving.
No, do not feel bad. So the other thing is you guys, our regular price on this is only 50 cents. So it's not like 37 cents is fabulous, but we're not a break the bank after.
Well,
And
because
we-
right, you gotta factor in that I'm paying for that toothbrush that we buy from Gum is more than everything, more
Yes,
than
she's
the little
saying.
packet
Yeah.
itself, so.
Yeah. And we
Yeah.
will be having the new packet, remember, is going to have the butter on gum toothbrush. It's going to have the expandable floss. It's going to have a 1 ounce toothpaste and it's going to have the oil. It's
When
going to
do
have
those
everything in
drop?
one. We're working on it. So that would be a question for Lene and
Okay,
she'll
so-
probably post that. I know we are working desperately to get those.
Yeah, see, because then we would
Probably
have,
under one
I would
roof.
like to wait.
Wait for that.
We would like to wait for that than to get the one that you
Yeah.
already have.
Yeah.
Yeah,
And that
so
one probably will be like,
Let's
what, an
reach
extra
out to
50?
her and
I mean,
find
50.
out when those are available. The price point's going to be a little higher just because of the
Yeah, because it has
toothpaste.
more stuff. I
Yeah.
expect
Well,
that.
We expect that, but we just
Okay.
want to do show them everything at once instead of like a little this. They're not,
Yeah.
the patients are not that, their attention span is not that good right now because of what's happening in the world.
Yep.
So everybody's a little bit
Make it
anxious, a little bit stressed.
simple,
Yeah, you got to keep it as simple as can be. Just
non-toxic,
take this whole thing
simple.
home and use it.
Yeah.
And the
there's no
greatest
way.
thing, and the greatest thing about our product is your patients can purchase this afterwards at Walmart or on our website on GuruNanda.com. It's not something that they're like, oh man, like I ran out and I didn't come back for my hygiene appointment until whenever. And they're not reliant on you to like, oh, you gave me that, but I never could find it again. So that's what we love about our product is
Yeah,
it is
that's
available.
true.
We even have stuff
Our
at the
brushes
dollar
are fantastic.
store.
Mhm.
So yeah. We
Yeah,
already
it's
went through
good.
concentrated mouthwash. This is our Oxy Breath mouthwash. Again, this one comes in a 3 ounce. It also comes in the bigger one like you guys have. I love this though because it has the hydrogen peroxide. Hydrogen peroxide's original use was for caries prevention and perio. Could this not be a very great price point product, therapeutic for a patient that may be struggling? Again, it has around a 3% hydrogen peroxide. If they're in bands, like if they're in ortho brackets, we do not want them, or buttons at all. We don't want them to use this product. But we do have a product, the 1.5, the anti-sore is this product, but they diluted the hydrogen peroxide to be less. And so
So
that's
this is 3%, right? The hydrogen peroxide?
this one has around 3%. It's
3%,
don't
okay,
quote
so-
me exactly on that, but it's
That's okay
yes.
because during COVID, we had to dilute it to 1.5 because
Yes.
3%
So
too much
that's our
going down in
new-
your gut.
The red one that you guys have, the anti-sore, that's the
Yes.
diluted. It's already diluted with essential oils and with breath freshening and with vitamin D, E, and K2 for epithelial and bone health. So it has amazing things in it.
And what's this one called?
This one's called Oxy Breath. And this is the white one you got.
Not burst.
Yeah.
Oh, we already have this one. We have
No.
this one?
Yeah, Oxyburst. No, it's
That's-
Oxyburst. Sorry. Yeah.
That's different.
I get it mixed up with their with Vita
Is this the same as the dual that we seen?
Yes, it's exactly the same.
Oh, they're
So
the
this
same
is
thing.
yeah,
It's the
this
same
is
thing.
Oxyburst. They have
Oh,
a dual, so it's called dual barrel whitening. Yep, it's dual
Okay.
barrel whitening. It's also
I
Oxyburst.
have it.
Yeah. So
You start
yeah,
opening these.
thank you. I misdid that because I was thinking our Vita Breath, which is our other one right here that I'll tell you about. So we have Breath Harmonizer. This is the one you said that is very popular. This is amazing because it also has sodium chloride. So it's going to help with those sulfur. Really, it's
I
an
wanted to
80.
make sure she talks about all of them for you.
Yeah.
Mhm.
Yeah.
Okay,
And
this is
so it
pink one.
has
I'm
this
on the
one.
pink one.
Okay. Oh, the pink
Green
one.
one.
So that
It's not the same.
pink one is our anti-cavity.
This
So
one's
that one is
anti-fat.
the one that has fluoride.
So
This-
we don't
this is-
have the unflavored, unsweetened, sensitive.
So
Yes, we
you
do.
do not, this one did not come in the pack because it
No, we
doesn't come in
we
as,
bought it separate. We
you
have
bought the
big one.
Vita Breath?
Oh, it's
Okay.
in the front. We do have that. We
I
do
mean,
have that.
that's the
Hey.
one we were using first.
Absolute, my
behind you
100%
100%.
favorite.
This is,
This,
Gross.
this
she
is
doesn't
my,
like-
did
try
you
to
say it's gross?
I didn't like it.
Okay, well, let me tell you though. So this was designed for chemotherapy. And the reason is they came to us and said,
Chemo.
we love your products, but the essential oils are too strong for people that are going through chemotherapy. And so we made them a rinse because the Cancer Institutes really desperately needed something. And so we have something without
Now I see
alcohol,
it
without
differently.
essential oils, without any sweetener. There is nothing in this but sodium chloride, baking soda, and salts. Now think about that as a pre and post surgery or pre and post procedural. Like this is a healing, it's a great rinse to use that won't burn, won't have any kind of adverse, like if somebody's like, oh, I don't like that taste. It has a very light, very light, almost salty taste to it. So again, this is a game changer for chemotherapy patients. It's a game changer for people that are under, like if they're having autoimmune attacks. Think about burning mouth. Think about lichen planus even, where it's like burns so bad, like anything. So this is a beautiful product available again at Walmart or you guys, and it sounds like you guys have this one.
I think, yeah, I bought the big one. I think that it's not, we weren't using it properly. And
Okay.
I'm
you were using it as a mouthwash, like a breath freshener? It's not going to be.
No, I tried it once because that was the first one we received, and doctor was like, "Go ahead and try it," and I'm like, "I
And you're
don't know
like,
about this
this-
one."
So
This is like
chemo.
water.
But now that I know that it's
Now you know.
it's I see it differently.
Yeah, so it
You've
does.
converted her.
Yay! So this is my go-to along with the MCT oil for cancer or for dry mouth patients because they can use
Okay,
this
that's
one
what that
along with
one's
our
for.
dry mouth rinse. But if they don't like mint, this is the one I would do. Now remember, this has sodium chloride also, so it is going to help with bad breath without having, any kind of a mint or any kind of flavor agent.
That's this one.
So-
This is your most popular one, the green one, right?
The green one it's very
It's up
strong.
to 12 hours of fresh
Yep.
mouth.
Yep.
Okay, so
If you
that
use
we
it
know what that
twice,
one
it's
is, right?
24. ADA accepted, fluoride and alcohol free. Yep.
And then the anti-sore one, we know what that one is, right?
Yep. The anti-sore
Okay.
one is the one that has the point. You guys, that one has the
Yeah.
diluted hydrogen peroxide.
Okay. And then we
It's
talked
got the
about
1.5.
the whitening one already. I just want to
The
make sure
whitening.
that
That
when
has
the
the
patient asks us, we're
3%.
not looking stupid, right? Okay.
No,
And
I
then
love
we
it.
did the dry
oh.
mouth one.
And Dr. Chan, and we are actually, did I say your name right? Is it Chan?
Chan.
It's
Chan?
okay. It's close.
Chan? Okay. We are getting in fact, I don't have the slide, but we are getting a mouth rinse like sheet for you to put.
Thank you. This is
in
what
your
I'm doing right
office.
now is trying to memorize them. I
Yes.
have all the bottles here.
I know. I'm going to make sure Lene watches this because you guys have been so educational on what you guys are looking for, what you're thinking about. I'm going to have Lene watch this because you've been the best presentation I've ever done with you guys, the really correspondence back and forth with, hey, we're looking for this or we'd like this.
Well,
Okay.
we stalked your website.
It's because our
Yay!
patients are brats.
I love that you were prepared for this because if anybody's not, then they're like, oh, I don't know anything about your product. So by the way, the ultrasonic cleaning pod,
Here it is.
We laminated it.
Oh, you got it. Okay.
I laminated it.
So you know what it would be great for you to do? Yeah.
You're-
I love my laminator.
There you go. I love it.
I laminate
So
no.
what
No,
what
but
you
I
will,
had you laminate it.
you guys are welcome to make another copy of that if you want, or we can try to send you another one.
Send us
But
another one.
Yes, please.
okay,
Yes, please,
if
'cause
you
I-
guys want to put that at the bar for your
Mm.
patients to actually look and see, and then they can take a picture of it.
Oh, we can put one on the front too, where the patients sign their
Yeah.
paperwork.
Yeah, when we get
everything-
another one.
We got to get more like,
Okay, we'll
it's gonna
get.
be
I'll
very
try-
organized.
Yes. Okay. So that's the thing for Lene. We're gonna add that is we've got to get another rinse sheet. Okay, I just wrote that down.
Retainers.
So you guys,
Doing all
the ultrasonic cleaning pods.
It's gonna be.
Did you have a question?
We were just talking about how I don't like to sell things. So but the only way to get people to try things is I have to have
it
them
on
here.
hand.
Nobody's going to go on the website and order this just because I say so. You know what I'm saying?
It's
You
hard.
have to
There will be
distribute it
some,
here.
but I will tell you, most of them will, if they shop at Walmart, they will go down the aisle and find it because they're already there. But if it's somebody going specific to find something, they tend to not. The best compliance you're ever going to have with a product or a therapy is to
Is
give
it
it at your office
Yeah,
and
we
say,
figured that
here
out.
it is. Now, I will tell you, most people will pay more than if they don't have to go to Walmart or don't have to go to a store because they
So how
know they're
much
going to
are we
spend
on
more.
this already?
Yeah.
Oh, okay. Sorry. I didn't mean
Oh,
to interrupt you.
no,
But-
the ultrasonic pods. So we were just on this. These ended up being around $16, the same with free shipping. Now, the reason why we love this for California is it is true. California just passed a $5,000 fine for putting a individual appliance in a communal ultrasonic. So these are great for your operatories because then you can actually just do it individually and then you can dump it out. You can wipe it with a Optum wipe, let it air dry. It's the same as like wiping all your other instruments. So this can be used. Your patients can purchase these at Walmart or on our website. They're around $39.99. Our price point at CDA was $16 a piece when you bought the pack of 24. So,
Wow.
yep.
Okay,
So that's
yeah.
that's a great one to have for your
That's
operatory. And you
what
can
they
move it
all ask.
around. It's about this
yeah,
big.
that's what I was
You can
looking
move
at.
it
The-
around.
Wait, the solution that you put in the ultrasonic?
You can do, no, you don't have to use that. You
No,
can use
same,
water,
with
you can
water.
use tartar stain remover, you can put an aqua pod in it if you want, you know, those little, or our concentrated mouthwash if you want, or the spray aligner cleaner. You can just do water and then use this if you have if you guys are doing tray aligners or Invisalign, you could just vibrate it and then take it out, spray this on it, let it sit for 5 minutes, then they can put it back in their mouth.
I
This
saw
is
it has a light on it. Does that light do
Yeah,
anything?
it has a blue light. So the blue
Okay.
light does help for cleaning.
Disinfect.
Yeah, disinfectant, but your best disinfectant will be like Optum wipes. It's a stainless steel drum, so it's easy to wipe out. So it's not, you know, a plastic drum. The top is plastic, but the drum part is the stainless steel.
Mhm.
I still like people to think about, you know, just a plastic bag. It makes it so easy to pull it out and, you know,
That's what we do
everything.
here.
Yeah.
I put
Yeah.
it in the ultrasonic in
Yeah, but
tartar stain remover in
can't-
in a plastic bag.
I know, but you can't do that anymore because California has the $5,000 fine if you're caught because it's in a communal ultrasonic. So they know that the pathogens are passing through that bag, that it's compromised. So that's why they're using this. It's a true regulation that just came out. We got verification from someone in a hygienist in
Just make our
California.
lives more difficult.
I know, but these are easy because they're just little and they're like, you can have one in your office if you don't, I mean, if you guys aren't using a ton of this,
Seriously,
you can-
there's more
gross.
what's more gross and trying to wipe that sucker out
That's
is more
more-
gross than
Then-
me putting it in a plastic bag in my ultrasound, my small
So
ultrasonic.
you can put it in a plastic bag in this if you have smaller ones? Is that what you were
Well,
saying?
yeah, because you're going to dump out the liquid. It's not going to have anyone
Oh,
else's
understand.
germs in
So
it
you
because you
just
can
do
wipe
it,
it.
but
It's
it'll be
individual.
like you put
Where
it in
your
here, so
other
put it in there.
thing, your
So in a
ultrasonic,
bag.
In a
if
bag, but
you
she
have
says
to-
that the
you're
bag
supposed
doesn't
to-
work. What it is they're trying to tell you that you need to clean the receptacle. That's
That's right.
basically what it is. But you know,
Yes.
when you ultrasound, all
Yeah,
that
it's
crap is
disgusting.
all
Yeah.
on the lid
Yeah.
and all
Yeah, but
along
you
the
can
light bulb.
wipe, yeah, you can wipe the lid or you can put things back in the plastic bag again, but you still need to wipe it. Absolutely. I think the problem with the communal ultrasonic that they have is that it's true. Like the regulations in California are that you have to dump the whole thing right afterwards and have it brand new for the next patient. And you're not going to do that. And so I'm sorry, but as a hygienist, I have not for years put any kind of anything in a plastic bag in my ultrasonic because it really grossed me out because there is contamination. So
Oh,
I've
but
always
ours
just,
is only for that. We don't put instruments in it.
We don't put
Yeah.
any instruments. Ours is just with a plastic bag for appliances.
Per
No
Right.
blood.
person. Per person.
Yeah.
Everybody get their own plastic bag.
Yeah, we don't mix it with instruments or any of the other stuff.
Okay,
Right.
but we have like 2 minutes.
okay,
left.
okay. And the last thing is, okay, this is the tray aligner cleaner we already told you about. It's hydrogen
We want
peroxide.
that.
And this is our white strips. Our white strips are amazing because they do have a low dose hydrogen peroxide. They have
Yeah.
coconut oil, so they help with sensitivity. Amazing. And price points like $10.
Can
Dr.
you
Fresh,
do you have the I need the if I'm going to talk about that with the patients, I need to know the specifics if you guys have the
yes,
scientific
on our
background on that.
website too. Yeah, and 6 and 8% hydrogen peroxide. They're
6 to
hydrogen
8%.
peroxide.
6 to 8% as well.
And
It's very-
most 6 to 8%, we have 4 of them in, or 14 strips in 6%, and we have 4 strips in 8. But we're moving, it looks like we're going to move just completely just 8 to give a little higher hydrogen. Yeah, we're changing that a little bit but for right now we have both of them. But it's a low dose hydrogen peroxide, so it doesn't cause a lot of sensitivity, and it's over the counter. Dr. Fresh just did a thing where he had 5 of them and said, you can buy 5 of mine for the cost of 1 of theirs. And so it's true. This is our new, we bought Natural Dentist. It has 20% purified aloe vera. You guys, aloe vera is amazing for healing dry mouth also. We bought the company and they also are stimulants, and they were going to go bye-bye, but GuruNanda jumped in. We bought the company. We will keep stimulants forever. So we're excited about that.
They bought stimulants.
They bought
Wait,
stimulants.
could you go back one more?
Remember they weren't going to make them anymore. Now they have them with them.
Those
Yep,
are the best things ever. And when
they're the
I bought them by
best.
the
And
gross.
well, guess what? People have been hanging on to them because they weren't in the stores, but now you guys can order them through Lene. So you guys are welcome to order them through her or through your Patterson or whoever you do. But here you guys need to take a picture of this. You guys get DP30 gets you guys 30% off our retail site if you want to buy any essential oils or any of our stuff on our retail or one item. This is a forever coupon code. Please do not give it to anyone that's not a dental professional like yourself. You can utilize it for your own self and your family. And then Kristin 15, because you had me today, that gets you guys 15% off the professional site. It's a forever. This is a forever code for you. You can use this Kristin 15 forever to get 15% off your professional site. And you know, that is something we're just grateful that you did. This also has Lene's information. I'm going to send you an email in just a second that will link you and her so that you guys can take it from there with her, because I'm just the educator.
Thank you.
You're welcome. It was so fun, and I so appreciate you guys, and I hope you just have a wonderful day and enjoy everything. So
You as well. So for the samples that we want to inquire.
yes, so give me the
okay.
I'm going to send the email, and in the email it says, please give me the list of things that you guys are interested in. And please send that as soon as you can so I can send that off to GuruNanda.
I'm going to send it right now.
But you know what?
Okay.
I wanted
So-
you to show me really quick. One last thing is I want to be able to do the water flosser.
Yeah, she showed us.
Oh, I missed it.
It's
Sorry.
It's on there. No, it's on there. I'm going to
It's
send you
on?
the recording.
Yeah.
How much
we'll
was how
send the
big was the
recording.
reservoir? How many mils is the reservoir for the water flosser? That's all I want to know. How much water does it hold? See,
It had it on there. I just didn't remember.
It
She's going back
did.
to it.
Let me
I'm sorry,
look if I can get
that's a
back
big
on.
deal for the old people because they can't hold it.
It actually, you guys, its reservoir is actually pretty amazing. It's bigger than you think because, let me go back
How
here.
many ounces is it? I mean, how many
I
mils
think
is
it's, and it
14?
has two ways of, it says, what does it say? 300 and, or 210 or 310 ml capacity.
That's a
Am I
lot
reading
more.
it right?
Yeah.
Yeah, 300, there it is right there.
Yeah.
310.
310 mils.
Mm-hmm.
It's actually got a pretty large capacity. It's pretty big.
They don't have to
And it
fill
can be opened and filled, or you can
Yeah,
pop it
definitely.
and fill it.
Oh.
So either one.
Okay.
Yep.
All right.
Just letting you know. This is
All right, I'll let you guys
473
go.
mils.
Thank you.
Thank you
Yeah,
so much. I'm
you are
sorry we just barraged you. It's just we are so excited. We're as excited as you are.
Well, I'm so glad you're excited because it's so much better to present to people who are excited than people who aren't excited. So
That's just look
I'm
at
so
you.
excited for you. Let's
Thank
get this
you.
going in your practice. We will be forever partners. You guys
Thank
can reach
you
out
so
to
much.
me. You're welcome to reach out to me with any education that you need. But Lene is absolutely the most beautiful, fabulous person, and she will take over from here.
Did we meet her that day?
Thank you. Yes.
We met her that day.
Kristen.
Thank
Yep,
you so
you met her
much.
at the CDA. All
Bye.
right. See